My research is a lot in dementia. Let's talk about dementia. It's really about finding those small things in a patient's care pathway which we can actually improve. So what in a patient's care makes a difference? Because I guess we don't have a cure yet for dementia. So there's not that overall big thing that helps us with dementia, but it's looking for small things that can improve the prognosis of people with dementia, or maybe the experience. So what medication should they be on? What medication should maybe stopped? What should they do or what they shouldn't do?
And then so you have set up this amazing, so using health clinical records that are available, you have set up this amazing database that's called actually CARICE. And I was wondering if you can tell us a little bit more, what you could, dig through this using natural language processing, as I understood.
Yes, I mean, it could be anything the clinician records, but it also needs to be something the clinician is actually interested in recording. Yeah. So, of course, they will record maybe comorbid conditions and they will record medications, but they might also talk about kind of other things. So basically, is the person living alone, or what something we identified as during the pandemic is loneliness mentioned a lot, and what does this have to do with the patient's trajectory? And at some point we actually looked at what kind of what predicts people with a mild cognitive impairment going to dementia in our cohort, and the only thing that actually came out as significant was loneliness. So the experience of loneliness at the time of mild cognitive impairment diagnosis. But a lot of the other things, what other diagnoses they had or what medications they took weren't that relevant. So sometimes it's just also like contextual factors, just contextualizing the patient's presentation and how does this affect their trajectory.
This is very interesting because, so in my work, we are interested, actually we have I'm a neuroscientist, but I work at the small molecule level, right? As opposed to the patient, or and loneliness is definitely not something that we have in our readout or our essay. And we are interested in looking at how a patient progresses from mild cognitive impairment to actually Alzheimer's disease. But we use human progenitor cells and the serum from the patient, and we look how their stem cells are modulated by the serum, which you could say in a way would take into account, environmental factor. But it's interesting how the two could come nicely together. And learning how you have this data. Actually, I'm just thinking in the future, because very likely we are using serum from patients that you have, right? If we could link them back with your database and have this data in our assay.
Yes, so that would be kind of a real strength. Patients recorded for those assays and will give their serum. I guess you record some information and you will try to stay in touch with them in a way. But I guess but it always depends on an incentive. So you need to call them, you need to follow them up. And I guess, but with the healthcare system, they just do stay in touch because it's in their interest to stay in touch with the healthcare system. So if they just consent for the health record being used, you could just follow them up forever.
And then so we could look back in time, right?
And you could also look back in time.
Like looking at what you identify as loneliness as a marker of progression, we could basically correlate it with our biological readout. And make together how work stronger, how we can predict which patient is progressing towards Alzheimer.
Yes.
So we should discuss more.
Yes, definitely.
Yeah, very good.